well, pretty much everybody has heard of menopause. It's the phase that hits when your menstrual cycles end in your midlife as a female. But what most people haven't heard of is perimenopause, although as of late, it's been all over your social media feeds, probably your podcasts, and if you're of the age group that I'm in, your social conversations. So I wanted to bring in the experts to talk all about it. Owner of MK Aesthetics in Minnetonka, Morgan Kraut, and then family nurse practitioner, Leslie Lee. Thanks for joining us, you guys.
Thank you for having us.
Yeah, thank you.
Okay, so first of all, I mean, I'm seeing perimenopause everywhere. What is it?
Tell us, Leslie, what is it?
So perimenopause is surrounding menopause. So menopause is just one day of your life. Basically, it's 12 months post your last menstrual cycle or period. And so peri is kind of that 10 years prior to it. Think of it like reverse puberty, right? We go through puberty, we have irregular periods, we have mood changes, we have all the things. Our hormones are starting to ramp up in puberty, and then we go through perimenopause and our ovaries start to kind of dim down. So we don't talk about it a lot, and there's a ton of research around it, but unfortunately women are somewhat underserved or less studied, and we just love that perimenopause is being talked about now and that we're bringing it on to MK, and it's very interesting to see what women's symptoms are when they're hitting that stage.
Talk to me about the symptoms, because what I see and read a lot is the symptoms can vary widely, and they're very, they're kind of obtuse. It's like, well, you're tired, your joints hurt, you might feel brain fog. Well, honestly, when you're in your 40s and you've got kids, those just seem like I might miss that, right? And I think a lot of doctors are missing it. You go to your doctor and you say, I have all these symptoms, and they're not identifying it at perimenopause. So how do I know if I'm in it?
Oh, man. So I think both Morgan and I have been in aesthetics for long enough, and a lot of our patients are coming in that age having the symptoms, right? They have brain fog. They're just not feeling like themselves. They might be more anxious than they used to be. They might be more irritable than they used to be. They might have lower moods than they used to. We're not talking like full-blown depression or full-blown anxiety. We're kind of talking about changes in the last 5 years, changes in the last 10 years. Both of us are moms, right? So running, and in our 40s, and women are kind of expected just to kind of show up and run around. So we get used to it, to your point. But then we start to think, we can't do this, right? It gets overwhelming, and we're more overwhelmed than we used to be. So it's changes in things that I think that women in our age now have given ourselves permission to be aware of the changes and then actually seek treatment for them. And
there is treatment. I mean, I don't remember ever hearing about perimenopause treatment, but there is treatment. I know you guys offer it at some of it at your clinic in Minnetonka. Talk to me about what you offer for treatment when we're talking perimenopause.
Yeah, so I think Leslie can speak to that as well, but at the MK, our medical wellness program, we are doing things like hormone optimization, so that's, people also know that as BHRT, metabolic optimization, that's also around the GLP-1, different peptides of sorts, and also some lab testing, just to get a baseline and just to see where your levels are at.
So if I come in and I say, I've got all these symptoms, and I'm of this age group, late 30s, 40s, what are you gonna do first?
Good question.
Yeah, so typically we'll have you in for a consultation and a comprehensive lab panel. Usually we like to know where the numbers are, and I believe that everyone should know their baseline. Whether you're 25, 35, 45, like if you can do it, go get baseline labs to know where you're at when you're feeling good. Because then we know that when we start feeling kind of, crappy, we're like, oh, what's off, right? It might just be something small like our vitamin D or our B12, something, that we can fix. But then also when we get into our 40s and 50s and 60s and we're really kind of, a wreck, and we haven't gotten the treatment that we wanted or needed or have been overlooked. I think that happens a lot. And so then we can actually look at the numbers and say, okay, here's your numbers, but then also here's your symptoms. And we take those two things together, and then that's how we make our treatment plan.
Yeah, and it is really easy to get your blood work done, really easy to go in and have your labs done. So it seems maybe daunting, but it's not. Talk about hormone therapy treatment. So there has been a stigma over the years about hormone therapy treatment. And that stigma largely is due to a 2002 Women's Health Initiative study that, warned of cancer and heart issues. Well, now it's believed that that study and the messaging were fundamentally flawed. And now actually the FDA has even initiated the formal removal of misleading box warnings of hormone products. And now people are saying, we had someone on from the Mayo Clinic saying, No, yes, get hormone therapy if you're in menopause. But for menopause, yes, hormone therapy. Can you also do hormone therapy for perimenopause when you're still getting your menstrual cycle, you're not quite menopause, can you start hormone therapy early?
Yes.
And do you recommend it?
Yes, yes. It's very customizable, really. And so again, the labs plus the symptoms, we take those and then that's what we base it on. And perimenopause is the best time to start because that's when your estrogen starts to kind of get a little wonky or your testosterone dips, right? So then we're thinking about mood changes and libido changes and dryness and just kind of like hair loss, like estrogen goes down, we lose our hair. Thyroid kind of goes a little wonky. So it's really kind of taking the time to give ourselves permission to say, intentionally going to get the help that we need from a provider who wants to listen and understands. And I think one of the things Morgan and I talked about in aesthetics, for us, it's been such a gift because we get to spend the time with the patients to learn what they need. So you can kind of talk to that a little bit.
Yeah, I mean, I've been in the past 12 years, you've kind of grown up with your clients. You've really got to know them. You build a trusting relationship and you get really vulnerable. And as I got into my 40s and the conversations just started shifting, you know, we talk about, you know, okay, you came in to get your glabella treated with a little bit of Botox, but we'd also go a little bit deeper than that. And it would be like, you know, I just don't feel like myself, or I just am not able to lose that extra weight like I used to, or why is my brain feeling like I have 5 million tabs open? So as we've grown with our clients and built that trust, you know, we just started having bigger conversations and we've been able to
It's like maybe we need to be doing more than just Botox, treating the surface level. There's some things going on. I wonder why, you know, so many women, and I hear from so many women who go into their OB or they go into their general medicine doc and they say, I'm tired. You know, I feel frustrated. I can't fall asleep. I can't get enough sleep. I never feel rested. Whatever. I'm feeling stressed. And the doctor brushes it off. Why are general medicine doctors, you think, not identifying perimenopause?
Yeah, so that's an interesting question. During my NP studies, really, like menopause was one slide. And the treatment was anti-anxiety meds and a sleeping pill, basically, right? So that was my education. So I've had to go kind of and seek out my own education. And I mean, now there are states mandating, right, providers to go back to learn about menopause. We're so educated on men, right? We are. A lot of our studies that we do are on men, and there's a gap. Right? There's just a little bit of inequality when it comes to men and women in healthcare. And so now it's really exciting to kind of watch the changes and also the women kind of fighting the battle before us and then also us trying to be advocates for it. But I think it's just a lack of education, right? We don't talk about the nutritional piece. We kind of look at women as like, well, you're really complex, so I don't know exactly what to do for you, but this might help. And maybe also just a time factor, right? Because we can't spend the time. If you're in a primary care, you're kind of go, go, go.
Right.
You can't really spend the time. Not that they don't want to. That's why most people went into medicine, was to help people. And so it's not their fault necessarily. And also there's not then you have to pull in like insurance, and there's also so many other facets of it that it's just an interesting topic, and I think it's just going to keep on evolving.
Well, and menopause is so easy to identify. Okay, you haven't had your menstrual cycle, but when you go in with these varied symptoms of perimenopause, and you're still of childbearing age, technically, you know, you're still getting a menstrual cycle, it seems like a lot of these doctors aren't even considering perimenopause as, you know, something that could be a potential. So it's great that we have like, you know, clinics like yours that are saying, hey, we treat for this, you know, we recognize the symptoms. They might be in your chair for something else, but you identify. Now, I want to talk peptides because a lot of people think of peptides and they think about GLP-1s. That's a very popular peptide right now, and I know you guys do deal in some of that, but there are various other peptides, you know, for skincare, for weight loss, for muscle gain. And peptides are actually now being used as a supplement to hormone therapy, right?
Yeah, so think about peptides as, I mean, they're amino acids basically, right? And they're kind of telling cells what to do. And if you look at the list of peptides now that people are using, you could look at like all of the benefits, right, of, you know, the muscle recovery and the skin health and the brain health and all the things, and you can think, gosh, for me, when I look at them, I'm like, I think I need all of them, right? Like, can I just have them all?
Take them all.
But it's true. But it's really kind of taking the time to say, okay, which one would be best for you? Again, going back to the symptoms, what is it that we are looking for to help and correct in that? And I know with aesthetics and just kind of the wellness industry, it's taking that time to be aware. I think women are one of the most aware humans on the planet. We've had to be aware of our bodies since we were, you know, menstruating, right? So once a month, we know what our body's doing, and we can, so we're really aware. So I think it's just more teaching that awareness around like, what's helping me, what's not helping me, because when you go in, even for peptides, you could get prescribed 5 different peptides, and you're like, well, which one's actually helping me?
So this is, I went down a peptides, I told Morgan this, because Morgan and I know each other outside of this. I said, I went down a peptides rabbit hole where it's like, I'm hearing, oh, peptides, peptides, peptides. So then I tried to learn more, and I'm like, I'm confused. Because there's so many different peptides for so many different uses. You can, you know, inject, you can ingest. How do I know what the peptides are that I should be taking? And does that go back to the lab work and the blood work?
Yes, it goes back to lab work, blood work, symptoms, and just knowing, right? Because there's so much education. I mean, that is one thing that MK and Morgan has done a beautiful job of just really basing a lot of things on educating our patients on what to look for and those things. And so, again, yes, you are right. Like, I can go down a rabbit hole and I know a decent amount about them, right? But I feel like there's a new one coming out, and then there's this one, and then there's that one. And so being able to kind of take it back and looking like, okay, how does it work? And what is its primary focus? And then also with the patients, which we do in aesthetics, is what are your top concerns?
Right.
Yeah. How is it? I mean, Maureen, you're a business owner in your 40s. You have a lot. You said you have a lot of clients sitting in your chair who are of that age group. Does that make you more passionate about the topic because you're living it right now?
Yes, it definitely does. I mean,
do you take these treatments? I mean, are you willing to, you know, stand behind what you serve up?
Yeah, that's a good question, because I think what happens is we do get overwhelmed, and I think oftentimes we think like, I should do this. But I think as I've always approached aesthetics in my life, I do not just jump in because everyone's doing it. I really take a step back, and one example could be the copper peptide. I've always struggled with sensitive hair and hair loss and thinness of hair. So that was one that really stood out to me. Not because everyone's doing it, because that's something that has been a pain point for me. So I think it's being really mindful of, we get caught up in the noise. We get caught up in Instagram and TikTok and what everyone else is doing. And I think that's where I think that approach of less is more. I love Leslie's approach of that, and not doing too many things at once, and not doing it just because everyone else is doing it. And I like the BP157. When people have injuries, I've seen people heal so many injuries that they've had from back in their younger years, right? So that to me would be something that if you are dealing with chronic injuries or things like that would be to look into, but not, to her point, doing too many things at once and not really knowing what's working and what's not.
Right, yeah, consult with a professional for sure.
Yes.
Do you find that people come in your office and they're kind of shy to talk about this topic, or because people are speaking so openly about it? You know, we've got millennials now going through perimenopause, and millennials seek out information on the internet. So it seems like maybe, you know, it's a little more, it's less taboo now. But do you find people coming in kind of like nervous to talk about this topic, or is it becoming more open?
I think I'm like 50-50 on that. I think there are people coming in and you can just tell something's different. Again, we built relationships with a lot of these people. So you're like, what are you doing? You look amazing. You can tell they have a glow. And those people are really open. They were like, you know, I had 2 babies. I had gained 20 pounds. I consulted a provider, and I got on a low dose peptide as well as some hormone therapy, and they're really actually proud of it. And they're proud of it because they feel so good that they want to share that with you, right? And so I think the GLP-1s, some people are a little bit more shy about that, just because they are like, I don't want people to know that I took a medication versus going to the gym every day and eating healthy. But I am telling you, I have seen people walk in radiating, and they just look and feel so good. And so those people talk about it. But yeah, I think we've built such good trust with our patients, so they do want to share.
It just saddens me that I think you go to a general provider and you say these symptoms, and a lot of times it's like, well, you know, get more sleep.
Yeah.
Or, well, that's just aging, right? When there maybe is some treatment for you because you are in that transitional perimenopause phase. So I'm glad that there are women providers now providing this. And so where can people find you if they want to come check out, hey, you know what, I'm feeling a little off. I'm in my 40s. Maybe it's time to talk to somebody.
Yeah, well, we're located in Minnetonka, Minnesota. We're MK Aesthetics online, mkaesthetics.com. We also have a QR code that you guys might be able to see as well, that you can scan it and they can learn a lot more about this topic.
Amazing. Okay, so women in your 40s, listen up. Don't be ashamed. Perimenopause is a thing. We're talking about it. There are treatments. We're going to get through this.
Yes.
We're going to get through this. All right. Leslie, Morgan, thank you so much for joining us
you.
from MK Aesthetics in Minnetonka. We're going to take a quick break. We'll be back after this.